Hi everyone, and welcome back to Dr. Kireen on Call. Today's video is on psychedelics or hallucinogens as part of my series on recreational drugs. I'll be talking about how they work, what their effects are, and their potential uses as a therapeutic in medicine. The first thing to talk about is which substances constitute a psychedelic. There are three big ones. The first is lysergic acid diethylamide, LSD, which is a synthetic drug. The second is psilocybin, which is a naturally occurring hallucinogen, and this is what is found in certain mushrooms, which is what makes them magic. And the third big one is another naturally occurring substance called mescaline, which is found in certain cacti. These drugs are called hallucinogens for the obvious reason that they make you hallucinate or have illusions, especially in the visual system. For instance, seeing things that aren't really there, or having distortions of objects that are in your visual field. There are lots of positive effects that people feel when taking psychedelics, such as euphoria to feeling more in touch with distant worlds. People describe having great insights into themselves, which can lead to profoundly positive changes in behavior. Some people describe having a mixing of senses, such as hearing color or seeing sounds. Unlike cocaine, which can have life-changing effects the first time you take it, psychedelics actually have a relatively good safety profile, meaning we don't really see people coming into hospital with bad consequences from taking psychedelics like we do with other drugs. But it's not all fun and games and fairies when taking psychedelics. People can hurt themselves, and the way that they do this is, one, by taking massive amounts, usually of LSD, usually intentionally. The second way is when people mix their hallucinogens with other drugs like heroin or cocaine. And the last way is that psychedelics can cause out-of-body experiences. People feel like they're invincible and so might jump off a roof, for instance. The other things to be aware of with psychedelics is that they're very psychologically agitative. So it's really important to control the context in which they're given in a positive way. If not, people could have bad trips, like having panic attacks or even frank psychosis. People also describe physical side effects like nausea, diarrhea, and headaches the day after they take psychedelics, depending on the dose that they've taken. Now let's talk about the possible uses of psychedelics in medicine, particularly in the field of psychiatry. Psychedelics are being used experimentally in the treatment of depression and anxiety. The way that psychedelics potentially help depression is by increasing the levels of serotonin in your brain, which is the way that some antidepressants work. There have been trials using psilocybin to treat depression and anxiety in cancer patients, and these have shown amazing results. Psilocybin is also being trialed as a potential therapeutic for OCD, smoking and alcohol addiction, and certain types of headaches. But way more research needs to be done to figure out the most effective way to take psilocybin, either as a single agent or combined with other established drugs. I do think there's a great possibility that psychedelics will become legalized in 5 to 10 years and used in mental health care. And especially given that we've realized that, like with physical diseases, treatments need to be much more individualized. And it's the same with mental health. Not everyone with depression is going to respond to Western medications like SSRIs. So I think there's going to be some exciting advances using psychedelics like psilocybin to treat difficult conditions in psychiatry. And that's all you need to know about psychedelics. Thank you so much for watching, and tune in to the next video in this series, which will be on marijuana or benzos. I haven't decided yet. But anyway, thanks, bye!